Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. Thanks for seeing me again.
Good morning. It's good to see you, though I wish it were under better circumstances. How have you been feeling since our last visit?
Honestly, doctor, it's been quite tough. My blood pressure has been high, and the pain in my shoulders, back, and hands just doesn't seem to get better. And just last week, I had this chest pain that really scared me.
I'm sorry to hear that. Could you describe that chest pain a bit more?
Sure. It felt like a heavy pressure right in the center of my chest. It lasted about an hour. Since then, I've felt short of breath occasionally, which is new for me.
And have these symptoms affected your daily activities or your ability to get around?
Definitely. The pain limits how much I can do. I can't even enjoy hobbies anymore. I've also noticed I'm not sleeping well because I can't find a comfortable position, which just makes everything worse.
Have you noticed if anything in particular makes the pain worse or better?
Cold weather seems to make it worse, and resting helps a bit, but it never goes away completely. I've been trying to manage it with the pain medication, but it doesn't seem to be enough lately.
Let's talk a bit about your lifestyle. Have there been any changes in your diet or physical activity?
My weight has gone up a lot recently, as you noted. I found it difficult to stay active with all the pain and my breathing issues. And my diet hasn't been great. It's been hard to keep up with healthy eating.
I understand. It's not easy to make these changes without support. How about your mood and alcohol consumption? Last time you mentioned some changes there.
I've been feeling pretty down. It's a lot to deal with. The constant pain, the weight gain, lack of sleep. And yes, I've been drinking more than usual. It sort of helps take my mind off the pain and the worries for a while.
It's important to address these issues holistically. Alcohol can affect your blood pressure and liver, especially considering your hepatitis C. It's good that you quit smoking. That's a big step. How are things at home?
I live with my daughter. She tries to help as much as she can, but she has her own life and responsibilities. It's tough because I don't want to be a burden.
You mentioned financial difficulties impacting your ability to attend physical therapy. Can you elaborate on that?
Yes, it's been a challenge financially. I had to cut back on physical therapy sessions because I just can't afford them as regularly as I should go.
I see. Let's make sure we address all these aspects today. I'll also go over the results of your recent tests. Your blood pressure today is still elevated at 147/88 mmHg. We might need to adjust your blood pressure medication if these changes continue.
That sounds necessary. I'm really worried about my heart with these new chest pains and my history.
Absolutely. And it's good you're taking it seriously. Your lab results show some issues as well. Your cholesterol levels are higher than we'd like, and your liver enzymes are elevated, which could be from your hepatitis C or potentially from increased alcohol use.
I didn't realize that could affect my liver that way.
Yes, it can, and considering your renal profile, with your creatinine at 1.4 milligrams deciliter, we need to monitor your kidney function closely as well.
Okay, what should we do next then?
Firstly, we really need to focus on your weight. It's affecting your health on many levels. Improving your diet will help, not just with weight loss, but also with your blood pressure and pain management. I recommend less fried food and more fruits and vegetables. Also, any amount of walking or light exercise you can manage would be beneficial.
I'll try to make those changes.
For your arthritis and pain management, I think occupational therapy could be very helpful. It can teach you ways to reduce strain and manage daily tasks more comfortably.
That sounds helpful.
Regarding your mental health, talking to a psychiatrist or counselor could help manage your depression and alcohol use. It's important to tackle these together.
I think I'd be open to that.
Good. We'll also adjust your medications today. I'll prescribe a different pain reliever and look at increasing your blood pressure medication. And given your recent chest pains, I want you to go straight to the ER if it happens again.
Understood.
Finally, let's schedule a follow-up in 2 months to see how these adjustments are working. We'll do more blood tests then and reevaluate everything.
Thanks, doctor. I appreciate you helping me figure all this out.
Of course, it's important we work together on this. You're not alone, and we'll adjust things as needed to make sure you're on the best path forward.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. It's been quite challenging managing my conditions lately, especially with the uveitis and glaucoma. My vision seems to fluctuate a lot, and the increased eye pressure has been concerning. The farsightedness adds another layer of difficulty. I've been under the surgeon's care for a while now.
Good afternoon. I understand it must be tough dealing with these fluctuations. How have your symptoms been since your last appointment?
Well, besides the eye issues, I've been feeling general muscle weakness and had some serious concerns about gout. I stopped the gemfibrozil and testosterone patches as you recommended, and there's been some improvement. The chest pains have also reduced, thankfully. It's been a relief, but there's still a lot going on.
I'm glad to hear there's been some improvement. How about your kidney function tests? Any updates since the last time?
Yes, the last tests actually came back normal, which was a bit of a surprise considering the previous concerns about reduced function. I had a bone graft done at the VA hospital, and there's follow-up imaging session scheduled to check on that.
That's good to hear. And your heart condition? Have there been any recent episodes of chest pain or discomfort?
The chest pains have decreased, partly thanks to the fish oil I've been taking. I've also been trying to stay active, which seems to help manage the pain. But I had to stop the aspirin because of the surgery. I'm wondering if it's safe to start that again, or maybe switch to something like Crestor for my cholesterol.
It's important to manage these symptoms carefully, especially considering your heart murmur and noted arterial blockages. Let's ensure we look at all your medications in the context of your overall health.
Exactly. And on top of my health issues, my energy levels have been really low. I've been thinking about whether it might be possible to restart the testosterone therapy, depending on what the labs show.
We'll definitely consider that. Have you made any changes to your diet or exercise routines lately?
Yes, I've been trying to improve my diet by eating more fiber and cutting back on red meat. And despite everything, I keep up with my exercise routine, which helps not just physically, but mentally too.
It sounds like you're taking proactive steps to improve your health. It's also important to manage stress, especially with your wife's recent surgery and the car troubles you mentioned.
It's been a lot to handle for sure. I'm just hoping to find some stability with my health so I can better support my family.
Absolutely. Let's review the clinical information from today's assessment and discuss the next steps. Your blood pressure today is 130/85 mmHg, which is slightly elevated, but within a manageable range. Your intraocular pressures are 22 mmHg in the right eye and 20 mmHg in the left, which we need to continue monitoring closely.
I see. How does everything else look?
Your eye examination showed visual acuity of 20/50 in the right and 20/40 in the left eye. Regarding your lab tests, your CBC is normal. Serum creatinine is 1.2 milligrams per deciliter, and your eGFR is at 60 milliliters per minute and 1.73 millisquared, which shows stable kidney function. Liver function tests are normal. Your testosterone is at 300 nanograms per deciliter, which is on the lower end of the normal range. The lipid profile shows total cholesterol at 190 milligrams per deciliter, LDL at 110 milligram per liter, HDL at 45, and triglycerides at 100.
What about the heart tests?
The ECG showed a normal sinus rhythm, and the echocardiogram noted a mild mitral valve prolapse with no significant regurgitation. Your ejection fraction is healthy at 65%. The stress test was completed without any ischemic changes, although you did report some mild chest discomfort that resolved after the test.
So, what do you recommend going forward?
For your eyes, continuous follow-up with the specialist is crucial to your ophthalmologic care. We need to reevaluate your kidney function and heart condition periodically. I suggest we restart aspirin and consider switching your cholesterol medication to Crestor after evaluating your overall medication profile. We should also redo the testosterone levels and possibly resume therapy, depending on your symptoms and lab results.
Thank you, doctor. It sounds like a comprehensive plan. I appreciate your guidance through all of this.
You're welcome. It's important that we keep monitoring and adjusting as necessary. We'll schedule a follow-up after your next set of lab tests and after your appointment with the eye specialist. Please keep up with the diet and exercise, and we'll review everything again soon.
Will do. Thanks again for your help today.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Today, we'll cover how to effectively monitor your blood glucose levels, a vital part of managing your diabetes. Do you have your glucose meter ready?
Yes, I've brought it, but I've never used it before.
No problem at all. I'm here to guide you through each step. First, let's ensure your hands are clean and dry. Now, please insert a test strip into the meter.
Like this?
Exactly right. Next, use the lancing device to prick your finger lightly to get a drop of blood. Then gently touch the drop of blood to the edge of the test strip.
That seems simple enough. It's done.
Perfect. Now your meter will process and show your current glucose level. It's important to track these readings. Do you have a logbook or an app where you can record these numbers?
I don't. Should I get one?
Yes, keeping a record helps you understand how food, activity, and medicine affect your blood sugar. It's also crucial for us to review and adjust your treatment as needed. Let's also discuss how often you should check your blood sugar and the best times to do so.
Now look at question 26.
Welcome everyone to our session on our new cardiac rehabilitation ward. This facility is dedicated to helping patients recover after heart-related incidents and surgeries.
Could you explain what makes this ward different from other facilities?
Certainly. This ward features advanced monitoring technologies and is staffed by specialists trained in cardiac care. Our services include personalized exercise programs, dietary planning, emotional support, and distinctive, comprehensive education about heart health.
What kind of support can families expect?
Family involvement is crucial. We provide counseling to families to better understand the recovery process and how to support their loved ones. Our team is always available to answer any questions and guide both patients and their families through the rehabilitation journey. This holistic approach ensures that when patients leave our care, they are well prepared to manage their health and prevent future cardiac events.
Now look at question 27.
This upgraded ventilator model is designed to provide enhanced patient comfort and more precise control over breathing assistance. Let's start with turning it on and accessing the main settings.
It looks more sophisticated than the older models. How do I make adjustments to fit different patient needs?
Right here on the touchscreen, you can easily adjust settings such as oxygen concentration, pressure limits, and breathing rate. There's also a user-friendly interface that guides you through the setup based on the patient's specific conditions.
And if there's an error or a malfunction, what steps should I follow?
The system includes built-in troubleshooting protocols. You'll receive immediate alerts if something goes wrong. Here's how you can navigate the error logs and make quick adjustments. Let's also go through regular maintenance procedures to ensure the ventilator operates smoothly at all times.
Now look at question 28.
Thank you for joining today's discussion on our new healthcare access policies. These changes are designed to streamline processes and enhance patient care.
What specific changes have been made?
We've broadened the scope of services available through our outpatient departments and increased the availability of specialists. Additionally, by integrating telehealth services, we're making healthcare more accessible, especially for those with mobility challenges or those living in remote areas.
How will this affect emergency services?
Emergency services will also see improvements. With better outpatient care and telehealth, we anticipate fewer non-critical visits to our emergency rooms, allowing for more focused care on true emergencies. These changes are aligned with our commitment to providing timely and efficient healthcare services.
Now look at question 29.
Setting clear rehabilitation goals is key to your recovery from this stroke. We need to tailor your therapy to fit your personal needs and aspirations.
I really want to get back to walking my dog and gardening, which I miss terribly.
Let's work on those goals. To regain mobility, we'll start with basic walking exercises and gradually increase complexity as you improve. For gardening, we'll incorporate activities to enhance your hand strength and flexibility.
How often will my sessions be, and what kind of support can I expect at home?
We'll start with sessions 3 times a week here at the clinic and provide you with exercises to do at home. I'll also coordinate with a home health therapist to visit you and ensure you have the support you need every step of the way.
Now look at question 30.
Today I'm here to talk about our new protocol for mandatory post-surgical assessments, which is a critical step towards ensuring patient safety post-operation.
What does this new assessment entail?
Within 24 hours after surgery, a trained nurse will conduct a comprehensive evaluation. This includes assessing the surgical site, pain levels, mobility, and overall patient response to the surgery.
How often are these assessments conducted?
The initial assessment is within 24 hours post-surgery, followed by daily assessments during the patient's hospital stay. We're also implementing follow-up checks after discharge to monitor long-term recovery. This protocol is vital for early detection of complications and ensuring a smooth recovery for our patients.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome back to our in-depth discussion on skin cancer, specifically focusing on melanoma. Today, we'll start by examining a patient case that highlights the critical aspects of diagnosing and treating melanoma. The patient, a 52-year-old Caucasian male, presented with an irregular mole on his back. He reported that the mole had changed in color and size over the past 6 months, which is a significant red flag for potential melanoma.
That's concerning indeed. Given that melanoma can be deadly if not caught early, could you explain how the ABCD criteria apply to this case and the implications for diagnosis?
Absolutely. The ABCD criteria, which stand for asymmetry, border irregularity, color variation, and diameter greater than 6 millimeters, are pivotal in the initial clinical assessment of suspicious moles. In this patient's case, the mole was asymmetrical, had jagged borders, contained multiple shades of brown and black, and measured about 9 millimeters. These characteristics justified an immediate biopsy to confirm the diagnosis.
That makes sense. What does the biopsy entail, and what are the implications of the biopsy results?
For suspected melanoma, we generally perform an excisional biopsy, where the entire lesion is removed, along with a margin of normal skin. This method not only helps in diagnosing, but also in removing potentially malignant tissue. In this patient's case, the biopsy confirmed melanoma, which necessitated further treatment and careful staging to determine the extent of the disease.
With melanoma confirmed, what are the next steps in treatment? How do you determine the best approach?
The treatment plan depends significantly on the stage of melanoma at diagnosis. Early-stage melanoma can often be treated effectively with surgical removal alone. However, if the melanoma has spread, treatment options include immunotherapy, targeted therapies, radiation, and chemotherapy. Our patient underwent a sentinel lymph node biopsy, which showed no further spread, indicating that surgical removal might be sufficient.
It's relieving to hear that early detection can lead to effective treatment options. Beyond the immediate treatment, what are the follow-up protocols for a patient like this?
Regular follow-ups are crucial. For melanoma patients, this typically means regular skin exams and possibly imaging tests every few months for the first few years after treatment. We closely monitor for any signs of recurrence or new suspicious lesions. Educating the patient on self-examination techniques is also a part of the follow-up care to promote early detection of any new changes.
Prevention and education are so important. Speaking of which, could you talk about the risk factors for melanoma and how public awareness can be improved?
Certainly. The major risk factors for melanoma include excessive UV exposure, either from the sun or from artificial sources like tanning beds, fair skin, a family history of melanoma, having numerous moles, and a history of sunburns. Public awareness campaigns are vital in educating the public about the dangers of UV exposure and the importance of protective measures such as using sunscreen, wearing protective clothing, and avoiding peak sun hours.
Awareness is key indeed. But let's also discuss how technological advancements have impacted the diagnosis and treatment of skin cancer.
The field of dermatology has seen significant technological advancements. Dermoscopy, for example, allows us to examine skin lesions in greater detail, enhancing our ability to distinguish benign from malignant lesions early. Additionally, advances in genetic profiling of melanoma have led to more personalized treatment approaches, improving patient outcomes significantly.
These advancements sound promising. However, the psychological impact of a skin cancer diagnosis can be profound. How do you address the mental health aspects in your practice?
Addressing the psychological impact is an integral part of the treatment plan. We ensure that patients have access to psychological support, including counseling and support groups. Educating patients about their condition and treatment also helps reduce anxiety and empowers them to manage their health proactively.
That holistic approach is so necessary. Thank you for sharing these insights. It's clear that managing melanoma requires not just advanced medical treatments, but a comprehensive care strategy that includes prevention, early detection, and psychological support.
Exactly. Our goal is to not only treat melanoma, but also to improve the overall quality of life for our patients. Thank you for this engaging discussion on such a critical topic in dermatology.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome to today's session, where we will discuss the intricate interplay between cardiovascular disease, CVD, and type 2 diabetes mellitus, T2DM, with a particular emphasis on the progression in women through various life stages, including postmenopause. Our discussion will be grounded in recent research, including pivotal studies from Harvard Medical School that highlight the unique challenges and treatment considerations for this demographic. Type 2 diabetes is a well-known risk factor for cardiovascular disease, the leading cause of death globally. Diabetic patients are 2 to 4 times more likely to develop cardiovascular complications than those without diabetes. This risk is particularly pronounced in women who experience a greater relative risk of heart disease associated with diabetes compared to their male counterparts. To contextualize today's topic, let's consider a case study involving a female patient named Maria, a 58-year-old postmenopausal woman diagnosed with type 2 diabetes at the age of 50. Maria's medical history is significant for hypertension and borderline high cholesterol, common comorbid conditions in diabetic patients that further compound her risk for cardiovascular disease. Maria's journey began with typical T2DM management strategies, including metformin and lifestyle modifications aimed at improving her diet and increasing physical activity. However, her transition into menopause brought about new challenges, including weight gain and worsened glycemic control, which are not uncommon as estrogen levels decline. Estrogen is thought to have a protective effect against the wall hardening of arteries, and its reduction during menopause can accelerate cardiovascular complications. Recent guidelines from the American Diabetes Association emphasize the importance of an individualized approach to diabetes care, which was certainly applicable in Maria's case. Given her postmenopausal status and escalating cardiovascular risk, our team decided to enhance her treatment plan. This included the addition of a statin for cholesterol management, an ACE inhibitor for blood pressure control, and a transition to a sodium glucose cotransporter 2, SGLT2 inhibitor, which recent studies suggest can offer cardiovascular benefits in patients with T2DM. Harvard Medical School's research underscores the critical nature of managing cardiovascular risks in diabetic patients through comprehensive strategies that address multiple factors simultaneously. These include glycemic control, lipid management, blood pressure control, and lifestyle modifications. Maria's case highlights the necessity of adapting diabetes management to changing physiological conditions and life stages in women. In managing Maria's condition, we also focused on patient education, empowering her to take an active role in her health. This involved dietary consultations to tailor her nutritional intake to her metabolic needs, especially important as metabolic processes tend to slow with age. Additionally, we integrated a regular exercise regimen that considered her joint health, another common concern in postmenopausal women. The emotional and psychological aspects of chronic disease management were addressed through regular consultations with a healthcare psychologist, aiming to enhance Maria's coping strategies and adherence to her medical regimen. The psychological impact of chronic disease is significant and can affect treatment outcomes, an area that is increasingly recognized as crucial in the management of long-term conditions like diabetes and cardiovascular disease. As we continue to advance in our understanding and treatment of T2DM in women, especially during critical periods such as menopause, it becomes clear that a multifaceted approach is not just beneficial but necessary. Research continues to evolve, and as it does, it informs our practice and helps us improve the long-term outcomes for our patients. Maria's ongoing care represents a prime example of the complexities involved in treating women with T2DM at risk of CVD. It requires a dynamic, responsive approach that addresses not only the physiological and metabolic changes associated with diabetes, but also the gender-specific factors that influence disease progression and patient quality of life. As healthcare providers, our challenge is to remain at the forefront of research and clinical practice, ensuring that our approaches are evidence-based and tailored to the unique needs of our patients. This commitment to individualized care is essential in managing the dual burden of diabetes and cardiovascular disease in women. The need for a comprehensive, adaptable approach that addresses all facets of the patient's health to optimize outcomes is demanded by the depth and complexity of managing type 2 diabetes in the context of cardiovascular health, particularly for women undergoing significant hormonal changes.